Welcome to Fascia Masters Q&A with D&Q, episode 25. How does block therapy benefit high blood pressure?
Hi there, my name is Deanna Hansen. I'm a certified athletic therapist and the founder of Fluid Isometrics and Block Therapy.
And my name is Quinn Castellane. I'm the VP of Block Therapy and the lead block therapist.
Many people today are struggling with high blood pressure, and there's a couple of reasons that we see to give you a different perspective as to why and how to create change in your body. So the first thing is the aorta is the main artery leaving the heart. It comes right through here and passes right through that diaphragm muscle. So if we don't have proper alignment, and the reality is we don't, we compress and strangle the aorta. So the majority of people are collapsing with their rib cage into the core, causing this compression. Imagine how challenging it would be to breathe through a straw compared to breathing normally.
No kidding, but also breathing through a straw and then having a kink in the straw.
Well, exactly, yeah. So the heart has to work a lot harder as a result of the collapse. Another thing that happens is when we're not breathing diaphragmatically, breathing through the muscles of the upper chest, this area starts to become really cold, and fats that are cold are solid. So these fats are starting to stick to the lining of the blood vessel, taking away even more space, which is really challenging the heart.
Exactly, and there is a solution for this other than taking actual medication. Again, the body is genius in its design and it wants to heal itself all the time, but we need to give the body the tools to open up so that the systems can flow and work properly and optimally. So first of all, Deanna talked about collapsing in the core. So then we're strangling the aorta, the diaphragm, and we're cold. So we can reverse that. What we need to do is first off, block these areas to release that grip, and then lift the rib cage up and access proper diaphragmatic breathing. So first of all, just breathing properly with your diaphragm, it's like a pump, it's like an elevator in your body that gently massages your abdominal organs. So every time we're breathing, we're massaging them, creating a heating effect. So those fats that are on the lining of the blood vessels will start to be heated, and it's not like they're going to waste, but we're gonna start integrating those fats into the body because fats are so crucial for health. So once we have accomplished that, we need to understand the proper structures and foundations of the body to maintain this space as well.
Yes, exactly. And really that's what this system is all about. There's three parts to the block therapy system: creating the space that we lose over time. And I know we've mentioned in past, but the fascia will grip and hold to bone and itself with a force up to 2,000 pounds per square inch. So to just simply lift that rib cage up and to start breathing on your own without releasing those adhesions is kind of impossible. But fortunately, block therapy creates that release. It's all about magnetics, and we get down right to the bone where that fascia is gripped and we create that release. Then we integrate proper breath, because talk about the base of the lungs.
Well, the base of the lungs is where a majority of our alveoli, our oxygen receptor sites, are located. So when we talk about pulling in 6 times the oxygen, we're really talking about increasing the absorption 6 times. So when we're pulling the oxygen to the base of the lungs, then we're able to increase that absorption rather than breathing through those muscles in the upper chest, and that's stressful alone. That would probably create high blood pressure for myself if I was continually breathing like that, and it does. So that's why we talk so much of the importance of proper diaphragmatic breathing.
As well, we also talk in our system about proper foundations to be able to support our cellular alignment, because even the way the fascia will grip the calves will pull the body forward, pulling that rib cage forward. So we have to look at the body as a whole and really understand what we need to do to feed the fascia system. And when we do this, we've even had people in our member site tell us that they've gotten off of their blood pressure meds. So it's really simple to do. It's a lifestyle though. It needs to be done. It needs to be a practice. We want to create proper habits, and proper breathing, in my opinion, is the most important habit. That and loving yourself.
Right.
Yeah, those two things are the most important things that we need to do really to start this process and create proper fascia health.
Awesome. Well, I think that wraps up this episode. So again, thank you so much for taking time to watch this episode. If you have any questions for us, please use the hashtag AskBlockTherapy. If you want to learn more about this and start with this process, just visit unblockyourbody.com. You'll get started for free there. And if you like this video, give it a thumbs up. Please leave your comments below if you have any, and we look forward to seeing you guys next week.
Breathe and believe.